Good afternoon. My name is Beatrice Shodiende Igenti, and my side of the project is to talk about what role the FDA plays in society. It is the duty of the Food and Drug Administration to protect public health by ensuring the quality, effectiveness, and protection of human and veterinary medicines, biological products, and medical devices, and by ensuring the safety of food, cosmetics, and radiation emitting products for our country. A broad variety of products, including foods, are regulated by the FDA, with the exception to some form of meat, like poultry and egg products, and those are regulated by the United States Department of Agriculture, Human, and Veterinary Drugs. And then we also have vaccines and other biological products like medical devices for human use, electronic products transmitting radiation, cosmetics, nutritional supplements, and tobacco products.
So I'm going to talk about when the opioid crisis began. It started in the 1990s, and this is when the FDA approved of the drug. They thought it was safe for people to use. So the first wave of it also hit during the 1990s. People were getting addicted to these opioid drugs and abusing them, such as overdosing on them. The second wave hit during 2010. People were still abusing those drugs and also taking heroin with it. The third wave happened in 2013. Manufacturers began to illegally produce fentanyl, which is a synthetic opioid pain reliever. And currently today, 128 people die every day from opioid overdose.
Opioids are a class of drug that are naturally found in the opium of a poppy plant. They work in the brain to produce a variety of effects, including pain relief. Many prescription opioids are used to block the pain signals between the brain and the body and are typically prescribed to treat moderate to severe pain. In addition to controlling pain, opioids also make some people feel relaxed, happy, or high, and can be very addictive. Many times, doctors will prescribe opioids for traumatic injuries or for post-surgical pain management without providing the patient without full instruction on proper care. The patient will then proceed to take the medication either too often or for too long and develop a dependency on the opioid. On the other hand, there are some people who follow the doctor's directions to a T and still get addicted. With these people, there is likely a genetic predisposition that leads their body to becoming more dependent and then addicted to the opioid. The most common prescription opioids that lead to addiction are oxycontin or oxycodone, any of the hydrocodones, and tramadol. There are other legal prescription opioids that can lead to addiction as well if not properly used. I feel like if the FDA required all doctors to check for genetic predispositions and to provide the same information about the medication they were prescribing, there would be less people getting addicted to medically prescribed opioids or narcotics.
Pros and cons of opioids, and what has the FDA done to regulate them? Some pros are cancer patients use opioids to reduce their side effects, and it's cheaper than morphine. Some cons are they're addictive, there's limited access to them. Some states have limits, and those states don't have a lower OD rate. Like their OD rate is like out of the world. The FDA has expanded the use of advisory committees, meaning they review with public opinion before having a new opioid out on the streets. Develop warnings and safety information labels, a way for doctors to know information on the risk and how to prescribe it better. Straighten post-market requirements. As serious as drug risks are, they use that to make sure it's not too serious, like it won't affect us.
Today, I will be talking to you all about how the American Medical Association helps the FDA combat the opioid crisis. The AMA urges policymakers to take meaningful actions to remove barriers and to increase patient access to evidence-based care. By doing that, it will save lives and help end the crisis. First, policymakers must take action. Sources say that health insurance companies continue to delay and deny access to non-opioid pain care evidence-based treatment for opioid use disorders. 92% of pain medicine specialists said that they have been required to submit a prior authorization request to non-opioid pain care. Secondly, remove barriers and increase patient access to evidence-based care. By doing that, it will increase the efforts to expand sterilized needles and syringes, services, programs, as well as the civil and criminal justice system. By doing that, it will help access high-quality, evidence-based care for opioid use disorders. This includes medical assisted treatment.
Hello everyone, I'm Christopher Valdez, and today I will be closing this argument talking about what the FDA has done to stop/prevent the opioid crisis here in the United States. The opioid crisis has claimed so many lives here in the US that the FDA has taken the approach to reduce the misuse of drugs and the abuse of opioids. In the FDA 2018 Strategic Policy Roadmap, they listed various facets to help reverse this epidemic. The facets included decreasing the exposure of drugs and preventing new addiction by ensuring that only indicated patients are prescribed these drugs, as well as making those specific prescription drugs last the duration of the period that they're needed. The second facet is to support the treatment of those with opiate use disorder, and to finally help and foster the development of new pain treatments and therapies.